My name is Katie Vickers, and I lead our client success team. And I'd like to welcome you to our Ignite Tech Stack Migration webinar. You have been selected to join us today as you're part of our Wave 2 migration, and we're really excited to go into depth today in regards to this migration. I'm excited to have an esteemed panel of colleagues here with me today to help support our conversation. We've got Megan McDermott, who leads our Integration and Transformation Office, Dr. Megan Bernardi, who's our Regional Medical Director, Rachel Goldman, our Senior Product Manager, Daniel Stafford, who leads our East Operations Group, and Kelly McNee, our Director of Business Intelligence and Analytics. Our agenda will follow the change management process, clinical experience process, patient experience, client experience, and throughout, we're open to take your questions to make this a more interactive discussion. So I would like to point out to you the Q&A feature here in Zoom. You may submit a question at any point in time. We will do our best to take those questions as we're going through the conversation together. Before I turn it over, I just want to reinforce our partnership together. Thank you for being in this journey to improve the lives of those that we serve, helping to make them the healthiest we can, and that's one patient at a time. So with that, I would ask Megan McDermott to share a little bit more with us about our technology and our process.
Great. Good afternoon, and thank you, Katie. Katie shared Megan McDermott. I'm helping lead our integration work. I'm super excited to be here today to share a little bit more about our approach with the integration, but we really wanted to start with grounding everyone a little bit to talk about our technology systems. We call our Marathon Health technology system the Ignite ecosystem. This is built upon multiple systems that support us in our ability to drive patient care, deliver reporting and analytics, and really drive engagement. So on the left-hand side, you'll see all of the inputs that go into our Ignite ecosystem. That is your eligibility files, historical medical claims, RX claims. We use ACG tools and health exchanges to help support getting all of that inputs, which then feed into our enterprise data warehouse, our Athena systems, and overall our Ignite tech stack that allows us to give you the outputs and our care teams the outputs to really deliver on our mission and our purpose, which is driving outreach towards patients, engagement, making sure we're making measurable progress and reducing risk. As we move forward, we thought it was helpful to just take a moment to really anchor on what is the structure that's supporting us to set up to successfully integrate as two organizations and complete these migrations over to a new electronic health system. So early on in our kind of discovery and bringing the two organizations together, we decided it was really important and critical to have an integration management office dedicated towards guiding our organization towards these consolidations and migrations. So we have a dedicated integration management office that's supported by our project managers and project management team that partner with all of our work streams and functional business areas. And you can see those listed here on the screen. So the project managers are really there to help guide, understand risk, help make connections across the organization, and making sure we're driving towards the best results for our clients, our patients, our teammates, and staying aligned to our purpose and goals. Early on in the integration, both organizations have experienced some level of integrations in the past through acquisitions or mergers. So it was really important that we took a time to really understand kind of what went well and maybe where do we have opportunities to improve from past transitions. So we really brought all of those best practices forward and have some great results and experiences to share with you from one of our most recent migrations. So up here, we completed a migration recently in September. So you can see there kind of the stats around that migration, but I really wanted to focus us on the bottom section, which is stats 2 weeks post go live. We saw a really great re-register adoption rate from our patients. So within 2 weeks, we had 29% of patients previously registered go out and re-register for the portal. That number continues to rise with some further member engagement approaches we're taking with our care teams and our centralized marketing team. We had over 2,000 new patient appointments scheduled through the Ignite technology, which is really kind of showing that quick adoption. So patients are registering and they're taking action to make sure they get the care they need. From a care team perspective, we saw 82% of clinical teammates closing their notes within the same day, really demonstrating that, the adoption and, Athena being a simple tool for the clinical teams to really transition to. And then from a support perspective, so during that transition time, we supported a command center for our care team. So if they had questions, they could call in or submit tickets. We saw really no wait time. So the average wait time was 18 seconds for one of our care team members to get access to either a Marathon Health teammate that can support them or one of our partners with Athena. And then we saw 98% of our tickets that were submitted were being closed. So we wanted to share this. We're proud of these stats. We also found lots of opportunities to improve through our last wave migration, and we're bringing all of those things forward. The status of our integration. I feel like I actually talked a lot about kind of what we've done along the way. So maybe Daniel, I'll hand it over to you to talk about kind of where we are today with execution and kind of what's next with the migration.
Love to do that. So yes, squarely in the execution phase, and it's actually pretty exciting. I've been traveling in Northeast Ohio for the last 48 hours or so. So I've gotten to see care teams that are in the training process, getting excited about the new tools they're going to have, which I know Dr. Bernardi is going to talk about. I've gotten to meet some of our providers that have been on the Athena platform, our electronic medical record platform, for quite some time. They're going to be our super users, which are connections we're making between veterans of the system. They're, in addition to the 18-second call time for technical issues or call response time, are there to help people set up their workflows. But I don't want to steal all Dr. Bernardi's thunder there. Just a reminder, November 13th is the go live date. So about a week before that, what we're going to do is start to work with your patients to send them a reminder and information about logging into the patient portal for the first time. Now, since for months now, they've been going into the health center and they've seen paper stand-up table tents, I think is what I'm supposed to call them. They're table tents sitting there saying, hey, Everside is becoming Marathon Health, to start to introduce the name, to introduce the concept of the new logo, which is important. Because if patients start to see a unified logo, they actually understand the communication that's coming to them, and they're able to easily digest that. The other thing we'll let you know is, in addition to that, once it's complete, we're going to again remind patients after integration to come in and register for that portal, and really excited to get them on board for that. So let's talk a little bit on the next slide about kind of one step further into what Megan was talking about at the very beginning, which is our Ignite platform. Simply put, Ignite is the entire engine that drives our organization, right? And so information drives that engine. It's like the fuel. What we don't want to happen is when your patients come in after migration for the first time, is they're having to retrain the providers on all the information that's in the system. So we're focusing on two big buckets. First is our data warehouse migration. So we've got your eligibility information, your historical information, our quality measures, so our clinical quality successes we've had and shared with you over time, claims information that we've gotten from your payer, in addition to information in our EHR, which is electronic health record. You've probably heard the word ECW, or you've seen the patient portal that you may be using up into migration that has your labs, your vitals, all the things that have happened in the health center. That all gets stuck in this oddly shaped funnel, and kind of comes out the other side to focus on three specific areas of support. So the first is clinical care delivery. So how do we, which we'll talk a little bit about in the next slide, personalized patient experience, which we'll also talk about. And then finally, how do we get you the information that you need to show the success of the program going forward? So go to that next one and see. Perfect. So first, your care teams have information at fingertips. They had a really great tool before. This migration is actually giving them an even easier and more digestible and quickly accessible set of information, which I validated yesterday with that provider I mentioned before that's been using Athena for quite some time. So it's going to give them the tools they need to be able to be efficient. Actually, the provider we met with was prepping her charts for next week. She's so excited about that. So, and then that's going to allow for the patient interaction to be more effective as well. So they're going to be able to continue to interact with their provider through the portal. There's through the mobile app as well, and then access information. So health tools, they're going to have a much broader more accessible, more beneficial portal for the patients with their health information at their fingertips, as well as education, like I said before. And then finally, you all as clients. This is a large investment and a really important partnership for us and for you all. And we want to make sure that we're demonstrating the success and the activity in the health center in a way that you can share with your stakeholders and that you're able to continue to use as we drive program strategy through your client advocate, which Kelly's going to talk about here in a second. So finally, what you may wonder is, hey, what's going to change? Well, good news, a lot of stuff's not changing. Maybe the most important stuff, your care team is not changing. The current products and services that you're offered is not changing as part of this migration. I will say later that there are some enhancements to products that didn't exist before. So there's actually an upside from a product standpoint. Health center hours are not changing unless we work with you and decide there's a reason to change. Again, not in any way related to this integration. And you're not going to have to change your eligibility file layouts. You're not going to have to go to your data team and send us anything in a different way. We've looked at the format that you're sending it to us now. We're going to continue to accept that to work off your plate there. What will change? We talked a little bit about, you see a torch there. The color is not changing. You're used to green, so that will remain consistent in your health centers and across the branding. But you will start to see the Marathon name, which we talked about. The technology platform will change, which is what we've talked about a lot so far. Patient marketing portal is going to change. The patients will need to go in and re-enroll in the new enhanced portal. Opportunities around enhanced and improved incentive and wellness portal. We do need to ask a favor, or may need to ask a favor over time. We do use email to drive our patient journeys. And as assume if you get lots of emails into your servers, that sometimes you may bounce them back to us. So we may need you to whitelist our email address. The marathon.health email address will work with you on that. And then finally, what is changing for the better, I think, is the client reporting. Enhancements, we talked about reporting already. Evaluation of your core and add-on product list. What that means is what I said before. There's some opportunities for some enhanced products that may meet some needs that you have around improving the health of your population one patient at a time. And then finally, it's going to be potential for increased health center access when we're on one platform, the opportunity to look at our network centers for your population that may not be at your home site. If you're one of our partners that has an on-site health center, the ability to access those networks. So incredibly excited about that. I could talk all day, but I should probably turn it over to Dr. Bernardi, my partner in crime here.
Thank you so much, Daniel. Yes, Dr. Megan Bernardi, and I'm the clinical leader of the East Region, and happy to share some of the clinical team experience with the new tech stack, with the new Ignite tech stack. So our care teams right now for Wave 2 are deep into their Athena migration and training. And right now the training engagement has been quite excellent. The platform for the training, we do provide self-paced modules for the clinical teammates learning, as well as live virtual sessions to help support their learning. Additionally, Daniel had referenced the Athena Champion and Super User program. I think this is really great. This was great for Wave 1. We're also adopting it for the Wave 2 users. But essentially, we know that our clinical teammates, some of them do need one-on-one support when they're learning new technologies. And so with this program, essentially, super users within the Athena EMR are able to be paired up with the Wave 2 learners, and then they can support each other, share screens, show me how to do this, and work kind of as an extra level of hand-holding for our learners. Additionally, our clinical teammates are learning best practices in terms of workflows. They're also learning about chart accelerators, which, as Daniel referenced, we've been meeting with lots of providers. This is very popular. This helps really improve their charting in terms of efficiency and using templates. Data migration is also a really important factor that we've been working on in clinical leadership. We've been also validating the data to make sure when the medical records come over that they're accurate and user-friendly.
Hey,
and then on the next, oh, yes.
Dr. Bernardi, just a question really quick for you.
Sure.
Given your experience in the medical world, is Athena a common tool? So it's likely many of our clinicians and care teams have worked in that tool at maybe a previous hospital or system that they practiced in historically?
Yes, that's a great question, Katie. So yes, several, and myself included, several providers and clinical teammates have experience with Athena in the past, working in other healthcare systems. But just in general, providers and clinical teammates are very used to learning and adapting to new EHRs. And I probably use, I don't know, 7 or 8 in my clinical career. So they're very used to kind of learning the new software. And essentially, just to give a little background on what EHRs are, because we keep using that term, these are essentially software platforms that allow our providers and clinical teammates to do things, to put in orders, to put in prescriptions, to chart, to do all that. I would say in my experience, like what sets EHRs apart, because they all do those functions, is like how many clicks it takes to get the job done. How many clicks does it take me to send in a refill request when my patient asks for it? And what we found with our feedback with current users and learners as well is that there's less clicks with Athena to get the job done, which in my mind equates to more time with the patients and less administrative burden. So sorry, long answer, Katie.
No, thank you for taking that question. And it's just a great reminder to all of our participants that we welcome your questions as well using the Q&A feature in Zoom. So I'll let you keep going, but I wanted to take advantage of promoting we're open to audience questions as well.
Great, yeah. So yeah, I just wanted to share here, like this is some like screenshots of what the Athena EHR looks like. Just going to highlight a couple things that I find important on here. You know, the advanced connectivity, you know, this is essentially with Athena, we are able to connect much easier to a lot of different other platforms, including health information exchanges, which allows us to get information for like in terms of admission, discharge, transfer notes, ER reports, outside information coming in seamlessly. Another important call out here is the ease of getting connectivity to the state immunization registries so that we can easily see those in our clinical practice, like served up to us in real time when we're seeing the patient. Another important thing I want to highlight on here is the care gap alerts. So these are, you know, reminders to the provider, patients due for their mammogram, patients due for their colonoscopy, and that's served up to them all within the EMR, and they're not having to switch to a different program in order to see those. So that should help one, alert the provider and get the job done. But the second part of that is the ease of getting those things captured within the EMR. That's something Daniel and I have also heard while we've been traveling around, is that that is very efficient within the Athena EMR to capture that. And what that means for you as the client is I think that you'll have more accurate reporting on the clinical quality metrics. So those are the main things I wanted to touch on, and happy to turn it over to Rachel.
Yeah, thanks, Dr. Bernardi. So now we're going to focus on changes to the patient experience. So specifically diving into some updates that patients can expect as they transition over to the Ignite technology stack. So we already mentioned the new name and new brand that's being introduced, but with that also comes a new patient portal and a new mobile application. So to be clear, right, all patients will need to activate a new portal account and download a new mobile app from the appropriate app store. So we do have both iOS and Android apps available. Account activation, like Megan said in the beginning, you know, was something we saw really great success with right out of the gate for the September wave of patients. So we did have over 4,000 successful registrations within those first 2 weeks of go live. And that number really has continued to climb week over week. I think we're up to about 7,500 now patients in total that have activated those new portal accounts. So once patients do go ahead and activate that new account, they'll see historical appointment and health data that's been migrated over from their existing Eversight accounts already in their record. And then additional data will populate as well over the coming months. All patients are going to be able to do the same things that they could do within their Eversight portal account. So they'll be able to self-schedule appointments, request medication refills, send secure messages, and view their health records. But the nice thing, right, is that they're also going to have immediate access to several enhancements. So some of the new features that patients will be able to have include things like the ability to complete intake and consent forms digitally ahead of their appointment. And that's going to be able to be done in both English and Spanish. They'll all have access to expanded wellness capabilities. So they'll be able to manage their incentives, participate in challenges, and sync third-party fitness devices directly with their portal accounts. And then the health records that are available as well will be more robust and more detailed. So they'll now include a health risk assessment that all patients can complete to help guide conversation with their provider during an upcoming visit. So in addition to, these new enhancements that I think are really exciting, there's also a number of things that are remaining status quo and that aren't changing for patients at all. So all patients will still be asked to complete a satisfaction survey after their visit, right? Going forward, these will be delivered via email or an iPad in the health center with SMS delivery coming in the future. I do want to mention, right, our NPS scores for the surveys that our September wave of patients completed directly after their migration was very, very high and on par with what we saw before migration as well. So our average NPS for those patients for the month of September was an 86 or is an 86, which is great. And we also saw, in some of our survey comments that patients indicated that health center staff really provided the same great service that they're used to while they were simultaneously navigating and learning a new EHR system that Dr. Bernardi just talked about. And really, that's the key, right? So all patients should expect the same level of care and attention from their care teams. Those care teams are not changing at all as part of this migration process. So if we move to the next slide, we'll now talk a little bit about how we're notifying patients about the upcoming changes. So we have put in place a multi-channel approach to communication, and that's going to include sending direct messages to patients via both email and SMS. We're adding messages across the current Everside portal and app and our client splash pages announcing the migration. And we're providing flyers and other materials that can be placed within health centers. And then lastly, we do have some additional resources, so digital slides, things like that, that clients can use to educate their employees and members about what's to come. This multi-pronged approach to communication will continue on an ongoing basis after the migration is complete, just as part of our standard marketing and outreach strategy. So now we'll take a quick look at timeline.
Oh,
Yeah,
there we go. I was like, wait a minute, when is all of this going to take place? So thank you.
Yeah, so we are getting there, jumping the gun a little bit. We have already started sharing news about the merger, right? The name change to Marathon Health through all of the channels we just looked at. But really, the month of October, the month we're in right now, this is when Go Live kits are going to be sent to all of our health centers, really to help them prepare for the migration. And then on November 4th, a Now Marathon marketing kit will be shared with all of our clients. And November 6th is the first patient communication. So on November 6th, patients will receive a coming soon message via both email and text that reminds them that this migration is forthcoming. Starting November 8th, this is a really important date. Patients with appointments scheduled immediately on the day of migration and the few days thereafter, they'll start to receive personalized outreach from their care teams with instructions to activate their new portal accounts and just generally make sure that they're prepared for their visits on those first couple of days. On the day of migration, November 13th, all patients will get messages prompting them to activate their new portal accounts. And then that's also the day that the existing client splash pages will be redirected. And after the migration is complete, all patients will be added into our standard digital journeys, and they'll continue to receive reminders to activate or register for their new portal accounts if they haven't done so already. So with that, the next thing we want to do is show you a short recorded demo highlighting some of those new features I talked about that will be available in Marathon's patient portal.
Today we're going to walk through a short demo of Marathon Health's web-based patient portal. So as a reminder, this tool is mobile responsive. So what that means is it does flex to fit the size of the device screen that a patient's using. And then all the functionality that we walk through today, similar functionality is also available within our native iOS and Android mobile applications. So we'll get started with the registration process. Patients are going to land on this page here after they click the link in their communications that they receive, and they're going to be prompted to click this Register My Account button to create a new account. They're going to be asked to complete this short form to share some basic demographic information with us, so name, address, phone number. And then when they hit submit, we're going to match their information to a user record in our system that's been received through our eligibility file process. After that, assuming we make a match successfully, patients will be asked to create a username and password. And once that's done, they'll be all set to use their new Marathon Health portal account. So they'll automatically be pushed into their account. So they'll land on this screen that you see right here. And you can see right off the bat that all of the same features and functionality from the Everside portal are present in Marathon's portal as well. So patients will be able to schedule appointments, they'll be able to refill medications, send messages or communicate securely with their care teams, and then view their health records. So I'm going to spend some time highlighting the new features that will be available to patients as well through Marathon Health's portal account. So we'll start with the scheduling experience. Within here, patients will be able to schedule appointments for themselves as well as any linked members of their household. So for our patient Beverly, she can select to schedule for herself or for her son Billy. To schedule an appointment, she can either select a visit reason from the common visit reason list you see here, or she can use the type ahead search to find what she's looking for. So today she's going to schedule a sick symptom visit. She's then going to be asked if she wants that visit to be done in person or virtually. When she hits search availability, Beverly can use the calendar on the right-hand side to navigate to the day that makes sense for her. So she's going to select an 8 a.m. appointment on October 1st. She can confirm her details, add any relevant notes, and then hit confirm and schedule appointment. The medication refill experience is very similar to the existing Everside portal experience. We won't spend much time here. Refills can be requested for the patient as well as any linked members of their household again. Messaging is also very similar, so patients can send messages for themselves as well as on behalf of a child or dependent. They'll be able to select a message reason from the drop-down menu here. Items like general inquiries, incentive-related questions, medical record requests are going to be sent to our centralized patient support team. And then things like general medical questions will be sent to providers in the health center. So patients can type in their message and hit send. We will spend a little bit more time in health records. The health records that patients will have access to through the Marathon Health portal are a little bit more detailed and robust than what existed on the Everside Health portal. So over time, as information is migrated into the Athena EMR system, all past historical data will also be visible for patients in their portal as well. So the first tab of the My Health dashboard here will show patients their biometric information. They can graph this to show results over time. Test results tab is going to show them past lab results. Within their health summary, they can view medications, allergies, health issues or problems, past immunizations, screenings, visit summaries, and they can print full visit summaries, patient education, and documents that have been shared by their provider. Each patient is going to have a customized risk profile compiled for them. They'll have goals that they can track that have been established in conjunction with their Marathon Health provider or health coach. And then they'll also have a view of current care guidelines that are recommended based on their conditions, their age, and other factors that they may have. And then last but not least is the questionnaires tab. So within this section is where Marathon Health risk assessment lives. This is often included in incentive programs, which is what's indicated by this trophy icon here. So this short questionnaire patients can fill out, takes anywhere from 5 to 10 minutes to complete. Previously, I did mention some additional incentive and wellness capabilities that will be available to all patients within the Marathon Health portal. So if patients are eligible to participate in an incentive program, they'll be able to see at a glance their status here. They can view additional details of their program, and programs are fully customizable with the assistance of a subject matter expert from our incentive services team. Patients have the ability to participate in wellness challenges. They can come here to track their progress. And then they also have wellness logs where they can input and track data related to fitness, weight, steps, sleep, and water. We offer the ability for patients to connect third-party fitness devices, so this data flows in automatically. So patients can sync Fitbit, Garmin, Strava, Apple Health, or Google Fit accounts. And then lastly, we do have some new additional wellness resources that are available to all patients within the Marathon Health portal. So patients will have access to HealthWise, which is a knowledge base of thousands of articles and videos on a variety of health topics. They'll have access to wellness workshops, which are designed by our own in-house Marathon Health clinical teams and provide some additional guided learning on common wellness topics. And then they'll also have access to Find Help, which is a free third-party tool, which will enable patients to find local community resources for things like food, transportation, or housing assistance. And our providers have access to this same tool through the Athena EMR. So as you can see, Marathon's patient portal is very easy to navigate, and it contains all of the features that patients are familiar with from their Everside portal accounts, plus a number of new additional features that we just reviewed. We're really excited for all of the existing Everside Health patients to experience this updated tool as they migrate over onto our Ignite platform.
Awesome. That was great, Rachel.
Thank you. Yeah, I think there's a lot of new exciting stuff that patients will get to experience.
Yes, speaking of exciting, we did get a question. I'd encourage everyone to take a moment if you have something top of mind to please use the Q&A feature. Daniel, maybe you and I could tag team this a little. There's a question about the timing of this migration. It's a very busy season for our HR partners. It's open enrollment time. There's lots of moving parts. I know as an organization, we did deeply consider that. We know it's a busy time for you. Our goal was to migrate as much of our clients and health centers as possible in this calendar year so that we have a full calendar year 2025 in the new system and really have everyone working in the same system, migration is done, and we can focus on continuous improvement and enhancement. So anything else to add there
Yeah.
around the timing?
Yeah, I think the other thing that we're hopeful, I think in many cases, this is when people are most engaged in their benefits and an opportunity for them to see what change is happening, what they're signing up for, maybe with a new health plan or a new type of benefit. So we're hopeful it was actually a good time if they're in that change moment for the year, and hopeful that helps with our adoption rate as well.
Yeah, and the one thing that I will mention too is that if you're in the process of working on your open enrollment materials and need supplemental materials like a flyer about the health center, a one pager, or some Q&A, please reach out to your account team. We can help pull that together rather quickly so that it's supplemental to the communications that you're rolling out tied to open enrollment, or as a quick follow-on to messaging that you're doing to your patient populations, your employee populations as well. So Rachel, there's one more question, Kelly, before we move to you around the wellness workshops. Can they be included or incentivized as part of a client's annual incentive program?
Yeah, good question. The answer is yes, they absolutely can be. That's something we see very commonly included in an incentive program. So if that's something you're interested in, the number of points that can be awarded for workshop completion is variable, and you'd work with your subject matter expert when designing that program to, come up with what works for your patient population. But absolutely commonly done.
Yes, I'll add, we are nearing the end of our own incentive program internally, and I just surpassed my 100 points needed by completing the workshop on finances. So it was a great reminder to kind of prepare our end of the year family reporting, but also to check the box to get my incentive award. So Thanks for the question. I'll turn it over to you next, Kelly. Thanks.
Thanks, Katie. Hi, everyone. Kelly McNee. I'm the director of our business intelligence and analytics team, kind of a fancy word for all things reporting. And I'm going to talk a little bit about what you should expect when it comes to client reporting. So I think some of the common themes that we've been hearing today is that the two legacy organizations were really similar in a lot of ways. And I think reporting is not an exception to that. So when we looked at both organizations and the reporting capabilities that each organization had, there was really an 85 to 90% crossover between the two organizations. And in the last 6 months, our teams have been working really hard to kind of close those gaps that we saw when we first did our gap analysis. This is to ensure that you see no gaps in your client reporting, and anything you used to see, you'll see going forward. It might look a little different, colors, layout and everything, but I think the way in which we define our key metrics will really stay the same. When we look at kind of the core components of how we show value across our business and kind of the value of an advanced primary care model, we can break it down really simply into 4 main buckets, right? Are people using the health center? Do they love it? Are they getting better? And are we saving money? And, there's a lot of different ways we can report out on each kind of many different metrics within those 4 categories. So when we talk about are people using the health center, right? We can look at just sheer volume of appointments. We can look at, are they mostly preventive? Are they mostly acute? Are they coming in? What kind of appointments? Are they coming in for, sick visits, chronic condition management visits? We look at engagement. So what % of your population has come in the last 12, 18 months, right? We can look at, are they engaging in preventive services? What clinics they're engaging in? And then again, looking specifically at capacity of health centers. So looking at it from an operational viewpoint, are our health centers busy? Do we need to add staff? Do we have room for more outreach? Those kinds of metrics. Moving over to kind of, do they love their experience? There's, again, a lot of different ways we can look at this. NPS, or Net Promoter Score, is kind of top of mind. Would your employees recommend Marathon Health to a friend or family member, right? And so Rachel touched a little bit about what that NPS was post wave, our first wave migration, consistently really high. We look at, patient satisfaction immediately after a visit with a Marathon Health clinician. And then again, we'd expect that if patients are utilizing and loving the experience, that they're going to come in multiple times. So we can measure, are people coming in once, twice, 3 times in any given time period? Once people are loving the experience and coming in, are we improving their health? So we can look at biometric risk reduction. What % of the population is improving their blood pressure, improving their BMI, cholesterol levels? We can look at kind of changes in risk thresholds between populations. So we can kind of stratify each population into a high risk, a moderate risk, and a low risk. And that's kind of how we can target outreach, track health mitigation efforts. And I think a lot of people touched on, Dr. Bernardi, you touched on quality measure reporting. So closing those care gaps, right? So the cancer screenings, making sure our diabetics are at standard of care. So that's another key way we can track health improvement. And then disease condition reporting. So prevalence of chronic disease management, what's that trend over time? How can we work to kind of strategize to get programming to target, diseases that are prevalent in your community? And then lastly, we look at, are we saving money? So there's a lot of different ways we can look at ROI and saving, right? We can look at, and I'll go into some more examples of this in a few slides, but we can look at sheer redirected care. So if a patient had gone into the community to get this care, what would they have paid? Referral avoidance, the value of same day, next day appointments. And so they're not going to the emergency room and the urgent care as much. And so those are the kind of 4 key metrics or buckets of data that you can expect to see going forward. I think And then these next few slides are going to just show a few screenshots of what the reporting might look like. And then again, some more examples of what kind of data we might be able to show you going forward. So again, looking at health center utilization, we really are looking at how people are utilizing the health center, when and why. And so we can look at those visits by that risk threshold, stratifying patients into high, moderate, and low risk. What day of the week is the most popular? We can look at heat maps for time of day in terms of like, is your population utilizing the health center more in the morning, in the afternoon? Do we need to shift maybe to a half day Friday? There's a lot of different, ways we can look at it and why people are utilizing it and make it more convenient for your population. Again, looking at those repeat utilization rates, hoping people are coming in multiple times. So we see, I think on average, our book of business is patients in a 12-month period are coming in about 3 times, which is fantastic. I know, like the traditional, way we think about it is you come in once a year for your annual physical. But I think because it's so convenient, because it's easy to schedule, because you don't have to wait 6 months to get in, people are really utilizing, all the services that Marathon Health has to offer. And then again, keeping track of cancellations and no-show rates for your health centers is a key operational metric we can track. Again, focusing a little bit on engagement, how people are using the health center, and again, why. So again, that risk level is a really important tool for us to use in reporting because it lets us target the population that is really in need of Marathon Health services. So that high risk, moderate risk, low risk, where they're engaging. So if you have multiple health centers, are people going to one health center over another or different locations? And then kind of in that bottom right is kind of a demographic view of what does your engaged and your unengaged population look like? I think understanding your engaged population is just as important as understanding your unengaged, because you can see, are the unengaged population, have they not been with the company long? Or is it a shorter tenured? Are there more males in that category? Are they younger? And so I think getting a big picture of, what are the key characteristics of each of those groups is a really important way we can strategize, future outreach. Looking at patient experience, I think really important patient experience. We talked about the NPS, looking at it over time. So trending that information year over year to ensure that we're improving each year. I think metrics such as, were you able to schedule at your preferred time, that we're getting directly from survey feedback? What was your average wait time? All those metrics are really crucial for us to ensure that your patients are getting, the optimal experience that they deserve. Health improvement. These are a few views that we love to show. So again, that clinical improvement in the top left, what % of your population who started at high risk for, let's say, BMI or blood pressure, cholesterol, what % of them are making progress? So I think really important to ensure that we're tracking in the right direction that way. Tracking care gaps or those quality measures over time against, HEDIS benchmarks or internal targets. Really important to ensure that our clinical team is working those lists, is ensuring that people are getting those screenings and staying at standard of care for various chronic conditions, because those are the top cost drivers that we see across our book of business. So the cancer spend, musculoskeletal, all that stuff. Tracking chronic condition prevalence, like I said, and then looking not only at patients making progress on biometrics, but really moving people from a high risk threshold into a lower risk threshold is something that we measure frequently and of course, like to tout that. And then finally, that last kind of bucket of that we like to look at is the financial results. And we can look at this in a lot of different ways. So we can look at it in kind of a big picture. What is the high level trend looking like over time? Starting at your pre-go live date, if we expected costs to go up at a certain inflation rate, what are your savings when we look at that? Are we above that inflation rate? Are we below it? we can look at what we call our engaged versus non-engaged analysis. So kind of matching claims data with our data from our EMR or Athena to look at who's engaged and what's their annual cost versus those who are unengaged. We can do so many cool things with that analysis, looking at chronic conditions, looking at place of service, major diagnostic categories. So those are some really great tools that we have in our tool belt that you'll be able to see going forward. And then in addition, we get to see, value of same day, next day appointments. So being able to get in that same day or the next day, and therefore avoiding trips to the urgent care or emergency room. Referral avoidance. What's the redirected value of a Marathon Health visit? So again, a lot of kind of diverted savings cost analysis that you'll be able to see going forward.
Hey, Kelly, I'm going to keep us moving
Yeah.
and maybe just ask you a couple questions on the next two slides. So all of this data and information is great, right? Like I'm an existing client. I'm excited to get it. I think on the next slide, we describe monthly reporting. So if I'm migrating on November 13th, when would I expect to see my first view into a monthly report with the new system? Sure.
Yeah. So we have committed to a deadline of providing monthly reporting to you 45 days post migration. So that is our deadline, and we are ahead of that deadline as of right now. We are confident that we will be able to deliver this new standard monthly reporting to you that will kind of cover all these kind of key metrics.
That's great. And then the next slide covers what's in an annual report, because typically on an annual basis, we work to kind of go deeper into the data and information and use that to help make recommendations. So if I normally get my annual report in January, is that when I can expect to see it? And Morgan, I think if you could move us to the next slide. There we go. Thank you.
Yeah, so I have a team of analysts that are dedicated to supporting our clients and their reporting needs. So we will work with your operators to determine the cadence in which your annual report normally happens, and we will work to stay as close to that kind of desired date as possible. So nothing should change there.
Awesome. So what I heard is 45 days after I migrate, I will hopefully be seeing my first monthly report in the new Marathon package. And then if I have an annual review scheduled, let's say at some point the first part of the year, I could expect that my annual package will also be reflective of all the great reporting you've outlined here for us.
Correct. Yep.
Awesome. That's great to hear. Daniel, does that spark any questions in your mind in working with clients or customers and in their expectations?
I don't think so. There may be some scenarios where your regularly scheduled meeting is on the 15th of December, for example, with 40. So we may move back a little bit later to hit that 45-day mark, closer to trying to get them in before the holidays. But that's the only thing I can think of right now.
Awesome. Thanks, Kelly, for that detailed overview. I would encourage our audience to submit questions using the Q&A feature here at the bottom of Zoom. We did get a few questions in advance. So I believe, Rachel, this one's for you. So if I understood correctly, patients will have to set up a new portal account to be able to have an appointment. When will they be able to do that, and how quickly can they start working in the new portal?
Yeah, that's a good question. So for patients that have already scheduled appointments on that day of migration, November 13th, and the handful of days afterward, they're going to be able to create those accounts or activate those accounts about 48 hours in advance. So that's 48 to 72 hours. That's when the care teams are going to start doing personalized outreach, really to handhold and help them along the way and make sure they're prepared for those day one visits. All other patients will get communication to activate their accounts on November 13th, the day of migration. I do just want to clarify one thing though, Katie, that if a patient has a scheduled appointment in person and they show up at the health center and they have not yet activated that new account, that's not going to stop them from being seen, right? Our care teams are still going to be able to provide the same care, see the patient for their appointment. They'll just encourage them to go ahead and create that account, before they leave or when they get home shortly thereafter.
And Rachel, there's a question that is right on point. So when will the Everside app be deactivated?
Yeah, so very good question. So the day of migration, when your patients go to log into their existing Everside portal or app accounts, they'll automatically get redirected to the new Marathon portal and prompted to activate their new Marathon account. So they'll still be able to log in. They'll just get that redirect message starting November 13th. The app accounts will be completely deactivated about end of March, early April. So once we complete our final migration wave, we're giving about a 90-day time frame before we completely deactivate those accounts.
So the message is it's important for individuals to move quickly to activate that new account, even if they don't have an appointment. But I think the reinforcing message is the data and information in that Everside app or portal isn't going away, right? That information is being transitioned, and Megan, maybe you can speak to this, has already transitioned, right, into our data warehouse, and we're scrubbing and mining that data already. Can you help us understand the process to, cleanse that data and make it ready and available to be used?
Yep, absolutely. So talked about it a little bit earlier. Dr. Bernardi hit on the clinical data migration. So we have a team that's been working for months on the moving over the clinical data. And actually, we've migrated all patients. So even for future waves and including any patients that are in this wave that's happening in November, we migrated clinical data up to July 1st. So that's already sitting in Athena. Our care teams have been validating it, and we're actively working on our next kind of refresh of that data. And that's what we're actively QAing now. So we'll have kind of multiple refreshes that occur in order to get kind of all data from ECW moved into Athena over time. It just had to happen kind of multiple batches based upon kind of how we're staging out the migrations and transitions, and allowing time for like clinical tasks to be completed in one system so we can bring those over. And we're being really clear with our clinical teams on how to work during that transitional time, right? So they will not lose access to ECW on November 13th. We're making sure patient safety and patient care is the top priority. So we want to make sure we don't lose a task in the midst of this transition. So our clinical leadership did a really nice job of kind of outlining what are those scenarios, how do you work, what's our expectation to make sure like patient care is the #1 priority through this process.
Awesome. There's great questions coming in, and I think we'll stay here with you. So if a patient doesn't want to download the app or use the portal, can they continue to call in to the health center or the centralized patient services to make that appointment?
Yep. So that option is still going to be available. So if your patient's currently called the centralized call center, that will continue. And that team's ready and to support that scheduling that appointment, or if they're used to calling the health center directly, that's also available to them. So we have kind of multiple options to make sure patients can get appointments when they need them.
That's great. So I know this is a question we get a lot, and maybe Daniel, if you want to help me here. So my health center today, let's assume I'm a client of ours, has Everside on it. On the outside, it's branded Everside. When can I expect that branding to change?
Yeah, I think that's a fantastic question. So I mentioned, luckily, the color green still our colors we're moving forward with. That's something we're working on over the next couple of months. It's going to depend on region. It's going to depend on significance of like how significant the change is. Quite honestly, it depends, as many of you are probably, although you can see me and I can't see you, chuckling about some local zoning rules that may take longer than any of us want to get a sign approved. Your ops manager, ops leader, client contact will be able to kind of give you a definite timeline for there. But over time, it's not going to all happen on November 14th. That's why we've been kind of sharing both brands in the health center over the last couple of months.
Okay, thank you. Rachel, you mentioned that the app is available in Spanish. Is it the complete app or is it just certain elements of data or information in the app?
So what's available in Spanish today is the intake process and intake questions that patients complete ahead of their appointment. So both the appointment reminders that go out, those will be in Spanish if a patient is natively Spanish speaking, and they'll be able to answer all their questions, sign their consent forms in Spanish. Our mobile applications and portal are not natively translated today, but I will say if patients are accessing the web portal on a device and they use their browser to translate things, it works really, really well. So not just for Spanish, but for any other language as well. That's what I would encourage. And I will just say we are, actively investigating how we add additional translations to our platform over the next year.
Wonderful. I also loved that feature you called out, the Find Help feature in the portal. I think that's amazing that our clinicians and our patients have access to help them find the resources that they need in the communities they live. So thank you for sharing all those updates. I think our questions have slowed. We know you probably have more. We have another session tomorrow if you want to join that as well, or please reach out to us. Like Daniel said, your account team members should be able to answer any questions that you have if they need additional support. We have open houses, we have weekly calls to help people stay up to speed. We know this is a lot of change. Change can be hard, but change can also help lead us to a better place in delivering great care and value for you to get those results that we know matter. We appreciate your partnership and we look forward to the next steps in our journey together. Have a great afternoon.
Thanks,
Thank you,
everybody.
everyone.